Case Study 2.
34-year-old pregnant lady Urvashi is admitted in your hospital with labor pains. You have been called to take care of the baby at birth. Please show us how you will prepare for birth and take care of the baby.
First, I will assess any antepartum or intrapartum risk factors involved. Antenatal history revealed that mother is having a full-term pregnancy. From the last 2 months, she is having high blood pressure and swelling in lower limbs. Ultrasound examination done 5 days back revealed that amniotic fluid is less than normal. After admission in hospital, labor pains are present and her blood pressure is high. There is presence of meconium and also fetal heart rate is below normal. Presentation of the baby is by head. From above history, it seems that mother is having many risk factors. Age more than 32 years, high blood pressure, oligohydramnios, decreased fetal heart rate, presence of meconium. From the above history, it seems that the baby may require resuscitation at birth. I have called my colleague trained in basic NRP to help me in taking care of the baby. Also, since we do not have any person trained in full NRP, so I have made arrangements to shift the baby to nearby SNCU if need arises and have informed them. Now I will prepare the labor room, wash my hands with soap and water and arrange all the supplies and equipment required for the baby's birth. I have closed all the windows and curtains are drawn, switched off fan. I have switched on radiant warmer in manual mode. Now I am washing my hands with soap and water. Wearing gloves and arrange all supplies required for the baby's birth. Keeping 2 clean cloths on radiant warmer, mucus extractor, gloves, cord clamp or cord tie, cotton balls, vitamin K syringe and 26 number needle, clean scissors to cut cord, wall clock with seconds hand, ventilation bag, mask size number 1, radiant warmer, oxygen source, stethoscope, suction machine, pressure should not be more than 80 to 100 millimeter of mercury, shoulder roll. Now I will check function of bag and mask. Term baby is expected, so I have taken number 1 mask and I have fitted the mask onto the bag. On squeezing the bag, I am feeling the flow of air on my palm. Pop-off valve is working. The bag re-inflates quickly when I release after squeezing the bag. Now I am ready for birth. Baby is born, time 11:40 am. Baby received in warm towel on mother's abdomen, head turned on one side, secretions present, wiped with gauze piece, drying the baby, removed wet linen. Is the baby breathing or crying?
श्वास नहीं ले रहा है।
Since the baby is not breathing, I have immediately cut the cord and I am taking the baby to radiant warmer for providing initial steps. Now I will provide initial steps. Position the baby, suction from mouth, then nose, stimulated the baby, repositioned baby. Is the baby breathing?
No, baby is not breathing.
Baby is not breathing, so I will provide bag and mask ventilation. First, I will again do suction from mouth, then nose. Selected the correct sized mask and correctly applied the mask onto the face and started ventilation. Breathe 2 3, breathe 2 3, breathe 2 3, breathe 2 3, breathe 2 3. Is the chest rising?
Chest rise not present.
We'll take first ventilation corrective step. Repositioned head, reapplied mask, again started ventilation. Breathe 2 3, breathe 2 3, breathe 2 3, breathe 2 3, breathe 2 3. Is the chest rising?
Chest rise not adequate.
We'll take second ventilation corrective step. Suction mouth, then nose. Increased pressure to squeeze bag. Breathe 2 3, breathe 2 3, breathe 2 3, breathe 2 3, breathe 2 3. Is the chest rising?
Yes, chest rise adequate.
We'll continue ventilation for 30 seconds. Breathe 2 3, 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 breathe 2 3. 30 seconds over. Is the baby breathing?
No, baby is not breathing.
Balwant, please help me. Start oxygen. Check heart rate. Heart rate 80 per minute. Heart rate less than 100 and the baby is not breathing. So we will have to transfer the baby to the referral center. Balwant, make necessary arrangements. I will accompany the baby and will provide ventilation during transfer.